What if I told you that something you do every single night, something most people over 50 consider completely harmless, maybe even healthy, is quietly accelerating damage to your heart right now while you sleep? Not smoking, not eating badly, not skipping exercise, something far more subtle, far more overlooked, and far more dangerous precisely because nobody is warning you about it. I'm Dr. Charles Bennett, and in the next 20 minutes I'm going to walk you through the science of what happens to your cardiovascular system after the age of 50 when this one specific sleep habit is present. And I'm going to give you the tools to reverse the damage before it becomes a crisis. Stay with me because what I'm about to share could genuinely save your life. Let's start with a fundamental truth that most people simply don't know. Your heart does not rest when you sleep. Many people imagine that sleep is a kind of shutdown mode for the body, a pause button where everything slows to a gentle idle. But that is not what's happening. Your heart is working through a very precise, carefully orchestrated series of biological events every single night. And after the age of 50, the margin for error in that process narrows significantly. The cardiovascular system becomes less flexible, less resilient, and far more sensitive to disruption. This is why a sleep habit that might have been relatively inconsequential in your 30s can become genuinely dangerous in your 50s, 60s, and beyond. So what is this habit? We're talking about fragmented, inconsistent, or chronically short sleep, and more specifically, the pattern of irregular sleep timing combined with either sleeping too little or, and this surprises many people, sleeping too long. This isn't just about pulling an all-nighter or having one bad week. We're talking about a habitual pattern where your body never receives the consistent, deep, restorative sleep it needs to complete its cardiovascular repair cycle. And the research on this is not mild or ambiguous. It is alarming. A landmark study published in the Journal of the American College of Cardiology followed over 700 adults and found that irregular sleep patterns, even when total sleep duration seemed adequate, were independently associated with significantly higher rates of metabolic syndrome, hypertension, and cardiovascular events. Another major study out of Harvard followed participants for over 6 years and found that people with inconsistent sleep schedules had measurably higher levels of arterial stiffness, elevated inflammatory markers, and increased risk of atrial fibrillation. These aren't fringe studies. This is peer-reviewed, rigorously conducted science that is pointing in one very clear direction. Now, I want to explain the mechanism because this is where it gets fascinating and where the real understanding begins. When you fall into deep, consistent sleep, what we call slow-wave sleep or stage 3 sleep, your body does something remarkable. Blood pressure drops by anywhere from 10 to 20%. This nocturnal dip is absolutely critical for cardiovascular health. During this window, your heart muscle repairs microdamage accumulated during the day. Inflammatory proteins like C-reactive protein and interleukin-6 are cleared. Cortisol levels reach their lowest point of the entire 24-hour cycle. Your parasympathetic nervous system, the branch responsible for rest and recovery, takes over fully. This is when the heart is essentially being serviced like a car getting its oil changed. And if you disrupt that process consistently, if you deny your heart this nightly maintenance window, the damage accumulates. Here's where age becomes the critical factor. In your 20s and 30s, your cardiovascular system has a significant buffer. It can tolerate occasional disruption and compensate. But after 50, that buffer shrinks dramatically. The arteries have lost some of their natural elasticity. The heart muscle itself has undergone normal age-related changes in its cellular structure. The endothelium, the thin inner lining of your blood vessels, becomes more reactive and more vulnerable to inflammatory injury. So when poor sleep repeatedly prevents that nocturnal dip in blood pressure from happening, or when it keeps cortisol elevated through the night, or when it prevents the clearance of inflammatory proteins, the consequences compound much faster than they would in a younger body. Let me be very specific about what happens inside your arteries when this pattern of disrupted sleep becomes habitual. Your body produces a molecule called nitric oxide, which is essentially the master regulator of vascular tone. Nitric oxide tells your blood vessels to relax and dilate. It prevents platelets from clumping together. It reduces inflammation in the arterial wall. Healthy, consistent, deep sleep is one of the primary stimuli for nitric oxide production overnight. When sleep is fragmented or insufficient, nitric oxide production drops. In its absence, your arteries become stiffer, your blood pressure trends higher, and the arterial wall becomes inflamed and sticky, the exact environment where plaque forms and cardiovascular disease takes root. Now there's another layer here that most doctors don't spend enough time discussing, and that is what poor sleep does to your hormonal environment. After 50, hormonal changes are already occurring. Testosterone levels in men are declining. Estrogen in women post-menopause has dropped significantly, removing a key cardiovascular protector. Growth hormone, which plays a major role in cardiac muscle repair, is primarily released during the first few hours of deep sleep. If you're not getting deep sleep consistently, you are chronically deficient in growth hormone, and your heart, quite literally, does not get repaired as effectively as it should. Simultaneously, poor sleep drives up ghrelin, the hunger hormone, which increases appetite for high-fat, high-sugar foods. It lowers leptin, the hormone that signals fullness. So poor sleep creates a hormonal cascade that not only damages the heart directly, but pushes people toward dietary choices that compound that damage further. This is not a simple linear problem. It is a biological feedback loop that, once established, tends to worsen over time. I also want to talk about something that is deeply underdiagnosed in the over 50 population, and that is sleep apnea. Because this condition sits at the absolute center of the relationship between poor sleep and heart damage. Sleep apnea is a condition where the airway repeatedly collapses during sleep, causing the person to stop breathing, sometimes dozens or even hundreds of times per night. Each time this happens, the oxygen level in the blood drops, the brain triggers a stress response, cortisol and adrenaline surge, and the heart is essentially jolted awake in a fight or flight state, all while the person is technically asleep and completely unaware. The cardiovascular consequences of untreated sleep apnea are severe. We're talking about a substantially elevated risk of hypertension, arrhythmias including atrial fibrillation, heart attack and stroke. Research consistently shows that people with moderate to severe untreated sleep apnea are 2 to 3 times more likely to experience a major cardiovascular event. What makes this particularly insidious after 50 is that the classic symptom, loud snoring and waking up gasping, is often dismissed or normalized. Spouses get used to it. Patients tell me they've always snored. They've always been a little tired. They wake up in the morning and feel like something is off, but they attribute it to aging. Please hear me when I say this. Chronic daytime fatigue, waking unrefreshed, morning headaches, difficulty concentrating, and waking up multiple times a night are not normal parts of aging. They are symptoms that deserve evaluation. If any of those sound familiar, I want you to talk to your doctor specifically about a sleep study. It could be one of the most important medical conversations you ever have. Let's transition now to the other end of the spectrum, because I mentioned this earlier and I want to address it directly. Sleeping too much. This surprises a lot of people. There is a widespread assumption that more sleep is always better, but the data does not support that assumption, particularly in the cardiovascular context. Multiple large epidemiological studies have found a U-shaped relationship between sleep duration and heart disease risk, meaning that both too little sleep and too much sleep are associated with elevated cardiovascular risk. Consistently sleeping more than 9 hours a night without a specific medical reason such as illness or recovery from extreme physical stress is associated with higher rates of coronary heart disease, stroke, and all-cause mortality. Why would too much sleep be harmful? There are several proposed mechanisms. First, excessive sleep is often a marker of underlying inflammation or depression, both of which are independent cardiovascular risk factors. Second, extended sleep is associated with prolonged periods of physical inactivity and decreased circulation. Third, long sleepers tend to have poorer sleep quality overall. More time in bed does not necessarily mean more time in restorative deep sleep. The relationship between sleep and heart health is not simply about more being better. It is about quality, consistency, and timing. The sweet spot for most adults, including those over 50, is between 7 and 8 hours of consistent, good quality sleep at a regular time each night. Now, I want to pivot to what you can actually do, because information without action is just anxiety, and that is not what this channel is about. The most powerful intervention for improving sleep quality and protecting your cardiovascular system is what sleep scientists call sleep hygiene, but I want to go deeper than the generic advice you've probably already heard. Let's start with your circadian rhythm, which is the internal biological clock that governs virtually every system in your body, including your heart. Your circadian rhythm is anchored primarily by light exposure. After 50, the lens of the eye thickens and yellows, which means less light reaches the specialized cells in your retina, responsible for resetting your internal clock each day. This means the light signal that should be anchoring your rhythm is weakened, and your circadian clock can drift, leading to earlier wake times, fragmented sleep, and reduced deep sleep overall. The single most effective behavioral intervention to combat this is deliberate morning light exposure. Going outside within 30 to 60 minutes of waking and exposing your eyes, not your skin, your eyes to natural light for at least 10 to 15 minutes, sends a powerful anchoring signal to your circadian clock. It starts a timer in your brain that approximately 14 to 16 hours later will trigger the release of melatonin and begin your transition into sleep. This is free, it takes 15 minutes, and the cardiovascular benefits of improved circadian rhythm function are substantial and well documented. The second area I want to address is temperature, because this is one of the most underutilized levers for improving sleep quality after 50. Your core body temperature must drop by approximately 1 to 2 degrees Fahrenheit for you to initiate and maintain deep sleep. After menopause, hot flashes and hormonal fluctuations make this thermoregulatory process significantly harder. Similarly, men in this age group often experience changes in their own temperature regulation. Keeping your sleeping environment between 65 and 68 degrees Fahrenheit is one of the most evidence-backed strategies for improving sleep depth and duration. A warm bath or shower taken 60 to 90 minutes before bed also significantly accelerates the drop in core body temperature when you emerge. Counterintuitively, warming the outside of the body helps draw heat away from the core and speeds the cooling process that deep sleep requires. I also want to spend a moment talking about alcohol, because this is one of the most persistent and damaging myths in the sleep space. A very large percentage of the people I see in clinical practice who are over 50 use alcohol as a sleep aid. They have a glass of wine or a nightcap because it helps them fall asleep. And yes, alcohol is a central nervous system depressant that does reduce the time it takes to fall asleep initially. But what alcohol does to the architecture of your sleep is catastrophic. It suppresses REM sleep in the first half of the night, and as it metabolizes in the second half of the night, it creates a rebound activation effect that fragments sleep, raises cortisol, increases the likelihood of sleep apnea events, and dramatically reduces the amount of slow-wave restorative deep sleep you get. Using alcohol as a sleep aid after 50 is like putting a bandage over a wound while simultaneously pouring salt into it. It is making the underlying problem significantly worse while making you feel like it's helping. Caffeine is the other side of this equation, and after 50 your liver's ability to metabolize caffeine slows considerably. The half-life of caffeine, the time it takes for your body to eliminate half of it, can be 8 to 10 hours in some individuals, especially as we age. This means that a coffee at 2 in the afternoon may still have a significant stimulating effect at midnight. My strong recommendation for anyone over 50 who is struggling with sleep quality is to move the caffeine cutoff to noon and observe the results for 2 weeks. Many people are stunned by how dramatically their sleep depth and morning energy improve from this single change alone. Exercise is another area where the evidence is unambiguous and the benefits are enormous. Regular moderate intensity aerobic exercise, things like brisk walking, cycling, swimming, has been shown to increase the amount of slow-wave deep sleep by a meaningful percentage, reduce the time it takes to fall asleep, reduce sleep apnea severity, lower resting heart rate, and decrease nighttime blood pressure. The timing matters though. High-intensity exercise within 2 to 3 hours of sleep can elevate cortisol and raise core body temperature in ways that actually delay sleep onset. For most people over 50, exercising in the morning or early afternoon delivers the best combination of cardiovascular benefit and sleep-promoting effect. I also want to touch briefly on the emotional and psychological dimension of this, because stress and sleep exist in a feedback loop that can trap people for years. Chronic stress activates the hypothalamic pituitary adrenal axis, which keeps cortisol elevated, which disrupts sleep architecture, which impairs cognitive function and emotional regulation, which makes stress harder to manage, which keeps cortisol elevated, and around it goes. After 50, Many people are navigating major life transitions, career changes, the loss of parents, children leaving home, relationship shifts. The emotional weight of this life stage is real, and it has direct physiological consequences for sleep and cardiovascular health. Practices like mindfulness meditation, progressive muscle relaxation, and even simple structured breathing exercises done before bed have been shown in clinical studies to reduce cortisol, improve sleep onset, and measurably lower blood pressure over time. These are not soft interventions. The data behind them is hard. One more thing I need to address, and this is important. If you've made lifestyle changes and your sleep is still poor, please do not suffer in silence, and please do not assume this is just aging. There are medical treatments and interventions, from cognitive behavioral therapy for insomnia, which is the gold standard first-line treatment for chronic insomnia, to CPAP therapy for sleep apnea, to hormonal evaluations, and in some cases carefully considered medical therapies that can make a profound difference. The relationship between poor sleep and heart disease is not a fatalistic one. It is modifiable. The heart has a remarkable capacity to recover when given the right conditions, and it is never too late to begin. So let's bring this all together. After the age of 50, your cardiovascular system depends on consistent, high-quality sleep to perform its nightly repair and regulation cycle. Fragmented sleep, irregular sleep timing, sleep apnea, chronic sleep deprivation, and even excessive sleep all disrupt this process in ways that accelerate arterial stiffness, chronic inflammation, hypertension, and the risk of serious cardiac events. The mechanisms are real, the research is clear, and the interventions, morning light exposure, temperature management, eliminating alcohol as a sleep aid, addressing caffeine timing, consistent exercise, and managing stress are within your reach starting tonight. Your heart is working for you every second of every day. The least we can do is give it the nightly maintenance window it needs to keep doing that job. If you found this information valuable, make sure to subscribe to the channel so you never miss a video. Hit the like button if this helped you, and drop a comment below telling me what topic you want me to cover next, whether it's blood pressure, inflammation, hormones, or anything else on your mind. I read every single comment, and your questions shape what we talk about next. I'll see you in the next one.